Hi, I'm Larry Mendte. Welcome to Jersey Matters. On this week's show, there's a real chance we may see a vaccine for COVID-19 by the end of the year. Rutgers researcher Dr. Reynold Panettieri tells us about the scientific trials that could make that happen. She is one of the most influential politicians in New Jersey. We talk with State Senator Loretta Weinberg about the budget, schools, and her plan to shake up Jersey transit. Governor Murphy still hasn't allowed New Jersey gym owners to reopen. So a South Jersey gym continues to defy Governor Murphy's executive order. We'll take a trip to Attilas Gym. And with options limited, have you considered whale watching? And now my interview with Dr. Reynold Panettieri, Vice Chancellor of Translational Medicine and Science at Robert Woods Medical Center at Rutgers University. Doctor, thanks again for your time. We really appreciate it. A lot of exciting news this week about vaccines. And I know that there's many people that are getting excited about the possibility of a vaccine either late this year or early next year. But I wanted to find out from you, from an expert, from a medical professional, what you're excited about.
Well, I'm excited about the speed with which the vaccine is being developed. There's always caution. Are we going too fast? Are we skipping critical pieces? But truthfully, Larry, the vaccine against SARS-CoV-2 is our quickest way getting our life back to the way we're used to. There's no substitute for this. Therapies are not going to meet the need. We need prevention, and prevention means vaccines. Now, the good news is that companies, this is private sector, big pharma, are working hand in hand with the FDA and with NIH in the development of vaccines. This is truly a federal and private industry partnership with one goal: to absolutely quell SARS-CoV-2 and COVID-19. So the most recent news from the UK in Oxford, in collaboration with AstraZeneca, showed their phase 1 trial was effective. That is, giving the vaccine caused more antibodies to be present in the individuals, and those antibodies were neutralizing. Very important point. That is, they can prevent the infection. So that's first step in the right direction. Now, that vaccine also sort of changes the immune response of the body so that it might actually retain a memory and be more long-acting.
And there was other vaccines that also showed positive results. They're not as far along as Oxford, but they're pretty darn close. And I know that the government just did a deal as of today with Pfizer to produce another vaccine. So is there a strong possibility we're going to be seeing more than one vaccine that does different things?
Undoubtedly, Larry. Matter of fact, at Rutgers, we're engaged with Moderna. Moderna is one of the companies that are way out in front also. We're planning to start that clinical trial of a vaccine. That's a phase 3 trial.
The Oxford study also said that it worked better if people got 2 vaccines, and that they're not sure at this point how long it lasts. It lasts at least 2 months, but they're saying they want it to last up to a year. So there's a lot we still don't know, and there's still a lot that can go wrong, right?
Yeah, no doubt about it. You know, in the Oxford study, as you mentioned, Larry, recall that there were a fair number of side effects. None of those were life-threatening side effects, but side effects nonetheless: fever, muscle aches, pains. You know, when people get side effects and adverse effects to a vaccine, they're not so anxious to get the vaccine again, right? Often it's misinterpreted as I got the infection. That's not the case. It's your body's reaction to a foreign protein, which you're seeing. You're not really getting the infection. It's simply an immune response to the protein. Now, with regard to boosters, that is a booster shot after the initial vaccination. Most companies are considering the need for a booster.
I know you've been very gracious in talking about other people's studies. Let's talk about Rutgers. What are you excited about at Rutgers right now?
We're really excited. You know, that healthcare worker cohort that we talked about
Right.
has expanded. We've now completed 5,000 patients, and we're now embarking on a partnership with Barnabas to include testing all of their employees and getting them into our studies. Larry, that's 44,000. Wow. So you're talking about an amplification of where we were just a couple of months ago by tenfold. That will serve as an incredible platform, healthcare workers, frontline workers, to enter into vaccine trials.
I know you have many studies going on at Rutgers right now involving COVID-19. You're making New Jersey proud. Let me ask you one question as a medical professional about policy. Should the schools reopen in the fall?
Well, that is a really difficult question. You know, I would say that schools should reopen if we could assure social distancing, good hygiene, and prevention of transmission. If we can assure those aspects, then I think going back to school is going to serve a quality of life, functional status, and for the children, that's immense. Hopefully we can do that. Maybe the vaccine.
Sir, thank you so much, Doctor. I always appreciate your time. That was Dr. Reynold Panettieri, Vice Chancellor of Translational Medicine and Science at Rutgers University. When Jersey Matters comes right back, the state wants to borrow $9.9 billion without you getting to vote on it. We talked to State Senator Loretta Weinberg about the budget proposal and the court fight to come. That's when we come right back.